All set? Afternoon, everyone. Thank you for joining us here today for the update from Erie County on September 9, 2020 with regards to COVID-19 and other matters. I'm joined by Kendra Schmidt from Deaf Access Services today. You have me here today. Dr. Burstein unfortunately could not attend. She's in a meeting, a conference call. I'm not exactly certain in today's day and age in regards to a number of issues with regards to COVID-19. So you have me today. Before I want to go through the presentation, I just saw the reports that were issued today with regards to Bob Woodward's upcoming book and the tapes he has of the president dating back to February, admitting he knew how bad COVID-19 was, and then in March how he wanted to play it down. And it sickens me to know that 190,000 of our fellow Americans have died since then, 682 of them in Erie County as a result of the coronavirus outbreak and COVID-19. The president takes an oath to defend, protect the Constitution of the United States, which I also look at as to defend and protect the citizens of the United States. And for the longest time, he and his administration didn't do a whole lot, and he just admitted today, or admitted months ago it appears, it was just released today, that he knew how deadly the coronavirus was. Back in February, he told that to Bob Woodward, and he also announced in March to Bob Woodward that he wanted to play it down to avoid a panic. Well, the federal government didn't act, but state governments acted, county executives acted, mayors acted, local governments acted, and the United States citizens didn't panic. We acted appropriately. And you have one responsibility as President of the United States, as to preserve, to protect, and defend the Constitution of the United States, just like you have to preserve, protect, and defend the citizens of the United States. And I am disgusted with what I saw, because I don't know how many have I seen you in the past 6 months at these press conferences. Some of them I didn't see you at all for the longest time because they weren't in person. But maybe if things had been done differently, we wouldn't be in the situation we are today, as a country and still as a region. So it disgusts me to hear that, because we deserve better from our president. Case data. 10,161 total positive cases of coronavirus. This is actually slightly lower than what was recently reported, because our Department of Health, which had about 10,190 cases, had identified a number of cases that were listed as Erie County residents but were not as part of the recent state testing. It was individuals who resided in other counties like Niagara County, Genesee, Orleans, Wyoming. And once the case contact tracers actually did their their initial work, they were able to identify that these people were not actually Erie County residents. So it's a slight reduction from what you might have seen from about a day ago. But still, it's over 10,000. Out of 352,617 specimens tested of Erie County residents, 682 people have died, as I noted. One death was in the prior week. We certainly offer our deepest condolences to the families and loved ones of those who've perished from COVID-19. While the deaths are down, and it's never good to see any death, it's probably one of the only weeks we've had recently where we've had just one death. And of course, these are all lab-confirmed cases. There's no presumed positives. These individuals were all positive before they died. On September 7th, there were 29 individuals admitted to Erie County hospitals for COVID-19. 7 of those individuals were in the ICU, and 3 individuals had an airway assist. You'll see there was a little bump up over the last few days where we actually hit 30 hospitalized in Erie County, and then it dropped down, and now it's back up to 29 as of September 7th. It's still low compared to where we were in April and May, in which we were hundreds. So I'm glad to see it's still low, but we have seen a slight uptick. And of course, these are not the same people just staying in the hospital. It's why you have ups and downs, or people that are discharged and new ones that are admitted. It doesn't show it there because it seems to be missing the 0, but there should be a 0 for the 7th. There were no deaths in hospitals on the 7th. Western New York hospitalization, there were 33 in Western New York hospitals and 10 in the ICU. So once again, if there were 29 in Erie County, that means there were 4 other individuals as Western New York is defined, which includes Niagara, Chautauqua, Cattaraugus, Allegheny counties, and Erie. So 4 other individuals in hospitals in Western New York, 10 total in the ICU. Cases by age and gender, once again, we talked 10,161, and you're starting to see some big growth in the age category of 20 to 29. We've been talking about it for the last few weeks, but you're really seeing it. And as I'll go into in a few moments, we're very concerned about what we saw in the last week's data with regards to younger individuals. And then you see it with the numbers here, 19% of all coronavirus cases, COVID-19 cases in Erie County are those between the ages of 20 to 29 since the beginning of the outbreak. But here's a big one. Last week, there were 496 confirmed coronavirus COVID-19 cases for the week ending September 5th. 323 of those were under the age of 30. You can see in the chart the big bar is the 20 to 29 age category, but then there's a large bar in the 10 to 19 age category. So we said we need to do a deeper dive to take a look at those individuals under the age of 30 and where they're from, age range and so forth. So of the 323 cases under the age of 30, 9 are from the age range of 0 to 4, 8 are from 5 to 10, 9 from 11 to 13, 24 are from 14 to 17. So if you look at between 5 and 17, which is, well, they would all be in school age, you have 41 cases of individuals that are between the ages of 5 and 17. But here's the big one, 207 cases between the ages of 18 to 22, which are college age. Is every one of those individuals in college? We don't know that for certain, but they're college age. 42% of all cases last week were from college-age persons, 18 to 22. And the diagnostic test results for this age group for last week was 6.9%. The test for all other categories, including that age group, was around 2. But it was 6.9%, nearly 7% of all 18 to 22-year-olds tested last week tested positive for COVID-19. The location. As a UB grad, this distresses me because of all cases reported last week, there were 496 cases. The zip code with the largest number of cases was 14214 with 78 cases. That zip code includes the neighborhood surrounding the University of Buffalo South Campus, University Heights, where a lot of students live off campus. The next largest zip code by comparison was 14211 at 25 cases. So more than triple the number of cases from the first to the second. 14214, which also includes Parkside neighborhood, also includes an area not too far from Canisius College where there's a lot of off-campus living for Canisius College students. So this is really concerning. The big increase we believe in the last week is because of college students. It's concerning, very concerning. And a lot of them don't seem to care unless they get sick. And many of them that were tested were sick. They got tested because they were sick. So we are continuing to work with area educational institutions regarding the positive tests of students. Initial contact tracing for the last 2 weeks indicates that some of the students who were tested, not the large majority like we saw last week, but a majority were sick when tested, lived off campus, and had attended house parties. So once again, if you attended a house party during the past 2 weeks, you should get tested. Simple as that. You probably were exposed to COVID-19. If you think about it, our test results on a weekly basis have been very low. 1%, we've grown to 2, we'll talk about that in a second. But 6.9% of all 18 to 22-year-olds tested last week tested positive. That should scare the heck out of a lot of people. The cases in general, we said 10,161 cases, 56% or so female, 44% male. And when it comes to where they live, we still have a greater preponderance of individuals. One of them knows they're sick. Thankfully, those individuals are getting tested. So if you attended a house party in the last 2 weeks, a college-age student, you should get tested regardless of where it was, whether it was in the University Heights District, if it was Canisius College, if it was Buff State, or if you went to a house party with other college-age students in Hamburg, in Marilla, in Tonawanda. I'm not going to go through every town and city and village, but regardless of where you went, you should get tested. Antibody testing. Antibody testing has continued to drop. Not as many people are seeking antibody testing, but the actual number is pretty much staying the same. We've seen a slight increase in the last month. The positivity rate total is still 6.7%, but we've been trending really closer to 8% the last month in positivity tests, but we haven't had as many people getting tested. So if you want to get tested, if you think you might have been exposed to the coronavirus over 3 weeks ago or so, really a month, you should get tested for antibodies. You shouldn't get an antibody test if you think you're sick now or you were sick in the last 10 days to 2 weeks, because you probably won't have antibodies built up. Mortality data, this follows very closely to the actual percentage of individuals who've been sick. 54% of all individuals who died in Erie County were females, 46% males. The age group, I haven't really showed this number recently, but we do have individuals under the age of 40 who've died from coronavirus in Erie County, 9 since this began. The vast majority of individuals are over the age of 70. There was 149 individuals who died from COVID-19 between the age group of 70 to 79. There were 397 who died between the age group of 80 and above. But just because you're younger doesn't mean you can't get sick. And just because you're younger doesn't mean you can't die. There are 9 individuals in Erie County under the age of 40 who died from COVID-19. There were 9 individuals from Erie County between the ages of 40 to 49 who died from COVID-19. The mortality data with regards to residence, race, and ethnicity, very similar to what we've been talking about the last few weeks. 24.6% or 25% of the people who perished from COVID-19 were City of Buffalo residents, 75% were the rest of Erie County. And as we've tracked and talked about for a while, we've been able to control coronavirus COVID-19 deaths among people of color much better than other parts of the United States. COVID-19 diagnostic and antibody testing, we're still testing. It's still free. 858-2929 to schedule. You can do antibody testing online. Schedule it online. It's no cost, free through Erie County. You don't need a doctor's order. We have clinics throughout Erie County. It is by appointment only, and please show up to the appointment, because we often have people call saying, can I go in that day? And the answer will be no. So if you don't show, you're taking a test away from somebody else. We have testing clinics in the month of September, I'm jumping ahead of myself, September, in Mondays in Williamsville, Wednesdays in Orchard Park, and Thursdays now in the City of Buffalo, and that is at the Convention Center. It's a drive-through location. You can actually drive in the back of the Convention Center on Pearl Street, drive into where normally they do the drop-off of the tractor trailers. You'll pull in, you'll get tested there, you'll pull out. Antibody test sites, we've got a number of them scheduled so far for the month of September. One this week at the Lancaster Senior Center on the 11th, the 15th at the Newstead Fire Department, Akron, the 19th at the Tosh Collins Center in South Buffalo, and the 22nd at the South Wales Fire Department. So we're hitting pretty much all parts of Erie County, north, south, and east, and the city. COVID-19 map, you've seen this before. We have a searchable map online. You go to erie.gov/COVID test sites, and you can find the closest site to you. This is all sites. This includes pharmacies and other places that are doing COVID-19 tests. It's not just Erie counties, but most sites require you to call ahead and make an appointment. The joint travel advisory between New York, New Jersey, and Connecticut. There were 4 states that were previously on that were taken off that are back on. Delaware, Maryland, Ohio, and West Virginia. So if you traveled to those states, since it was announced that they were back on the list, you are supposed to quarantine for 14 days because you may have exposed yourself for COVID-19. Now we get asked the question, what if I flew through an airport and I wasn't there for even just a couple hours, and I landed in Ohio and then I took a connecting flight elsewhere? You have to be there for 24 hours is the way the rule is. So if you just drove through and stopped off at a gas station to fill up your pump and you're going through Ohio to go to Michigan, that's not itself going to be subject to the quarantine. But if you stayed for more than 24 hours in Ohio and you expose yourself to others, like West Virginia, Maryland, Delaware, and all the states in red, then you are supposed to quarantine for 14 days. Erie County responds. We've done a lot, we've talked a lot, and there's more to talk about. Voting update, mail-in ballots. Governor Cuomo, of course, recently signed an order that all registered voters may request a mail-in ballot, absentee ballot, for the November 3rd general election due to COVID-19. Anyone who's a registered voter can do that. You may request a ballot online or print out an application at the Erie County Board of Elections website, which is elections.erie.gov/absentee info. So anyone can request it. The first day that the ballots could be sent out is actually tomorrow. So a lot of people are saying, I requested a mail-in ballot, I haven't gotten one yet. The first day it could be sent out by the Erie County Board of Elections is actually tomorrow. You shouldn't have gotten one yet, but if you do request one, you will get it, and you can do a mail-in ballot. Now, a lot of people are like, oh, I want to go in and vote. You can still vote. You can vote the normal way that you normally would on Election Day by going to your local election district. Or, and this is what I'm going to take advantage of, early voting. Starting on October 24th, all registered voters in Erie County are eligible to cast an early voting ballot at any one of 37 designated early voting locations. They're on the screen. Every town has one. The cities of Lackawanna and Tonawanda have one, and then every council district in the city of Buffalo has one. So between the dates of October 24th to Sunday, November 1st, you'll be able to go early voting. Monday through Friday, early voting locations will be open from noon to 9, and Saturday and Sunday they will be open noon to 6. I'm going to take advantage of early voting myself. It's a great way to vote, get it done. The lines generally have not been long, and your vote is counted on Election Day. A lot of people ask, well, if I vote early, is my vote counted on Election Day? And the answer is yes. Actually, the first ballots or first votes that are counted by the Board of Elections on Election Day are early voting results. Then they go to the Election Day results. Absentee mail-in ballots are not counted until days afterwards. So if you want to know that your vote's been counted on Election Day, vote early or vote on Election Day. I'll be early voting. The Erie County Business Task Force, we continue to do lots of work with the Erie County Business Task Force. And on September 22nd, there will be a free Zoom webinar for small business owners on COVID considerations and contact tracing. I will cover the health and legal aspects of what happens if an employee tests positive. We do not anticipate, or I shouldn't say, we do not expect any business to do the contact tracing. The Erie County Department of Health does the contact tracing, but we need assistance from business owners if we have to do the contact tracing because one of your employees tests positive, because we need to know who they may have been exposed to during that day, what shifts they work, things like that. So this is a free Zoom webinar. You can go online, you can get more information from actually the Amherst Chamber of Commerce at amherst.org. And I want to thank our partners, including the Capola Law Firm, Back to Business, and of course the Erie County Department of Health for their assistance in this, as well as the Amherst Chamber of Commerce. Free Zoom webinar, sign online. CARES Act funding. More than $115 million has been spent or budgeted by Erie County responding to the COVID-19 outbreak as a result of using CARES Act funding. The total award from the federal government was $160,306,414. A lot of money. But we spent a lot of money, or we've budgeted a lot of money for programs to be spent in the next couple months. For example, the county's response, $75 million plus. That's direct response. That's issues associated with PPE purchasing for nursing homes and hospitals and even our volunteer fire in our local communities. Schools, we have set aside $15 million plus for schools, and it's my understanding is almost every one of those dollars is out the door. That's to be used to protect students, protect faculty and staff if they have in-class education, as well as virtual costs. Child care, we announced last week, $25 million available in 3 different buckets for child care, one which will go directly to child care centers, another one which will go to help set up distance learning centers, and a third which is additional money we're putting in to assist families pay for child care expenses through the child care subsidy that we offer. And don't be surprised, even if you make over $100,000 a year, you can qualify for child care assistance based on the levels of assistance that we have. So if you think, we have 2 children we need child care for, but a husband and wife, we make $80,000 a year combined, you still qualify for child care assistance. And soon we'll be announcing a program for those facing eviction and others facing foreclosure. But in the meantime, we want to get this message out. There is an eviction moratorium that exists, not just in Erie County, not just in New York State, but now the whole United States of America. On September 4th, the Centers for Disease Control and the U.S. Department of Health and Human Services announced a temporary halt on all residential evictions through December 31st of this year. So you can't be evicted. But you have to pay your rent because you are expected to pay your rent. You're putting landlords in a bad situation because they often have mortgages to pay with regards to the properties that they own. And you can acquire, if you haven't paid your rent, interest and penalties. And when the eviction moratoriums expire, you can be evicted. So there are programs that are already in place to help those tenants who haven't been able to pay their landlords. We want you to pay your landlords. You need to call 211. You hear about 911, but 211 is a reference service that Erie County is working with that can offer assistance and provide tenants who have not been able to pay their rent the information they need to get resources to help them pay their rent. As I announced or just noted, we'll be announcing some programs very soon with regards to evictions, tenants that are facing evictions, or homeowners that are potentially facing foreclosure. But we want you to know resources exist. We have a little technical glitch here. One of our reporters is showing, are you hard of hearing? That was pretty loud, Michael. Others are laughing. He's just turned red. That's what happens. My father's ringer, though, is very loud. He will not claim that his hearing is the same as it used to be, but he will not also claim that he has any hearing loss, and he is. He certainly does. So, Dad, I keep on telling you, get a hearing aid. So where I was, 211, call 211 if you are having trouble paying your rent. COVID-related complaints, you've seen this thing before. You can call us at the Department of Health at 961-6800. But if you watch the governor's press conference about an hour and a half ago, he announced a new New York State compliance line where you can call or text if you believe a restaurant or bar is not complying with the standards. The call number is 833-208-4160. Text, you can text it at 855-904-5036. So if you go to a restaurant or a bar and you're like, oh, I don't believe they're following the standards with regards to occupancy and mask wearing, you can call Erie County, you can call New York State. And if I'm a business owner, this is the last thing I want, especially people calling New York State, because the state liquor authority is going to be involved and you can lose your liquor license. And then if you have other issues, other businesses, you can call the New York Pause number, 1-833-789-0470. Finally, before we open up to questions, the census. Earlier today, I joined Mayor Brown, as well as representatives from the library, the Urban League, as well as the International Institute, to talk about the census and how it's going in our region and how it should be better. The census ends September 30th. You've heard me talk about it quite some time. Enumerators are walking door to door, but they're not going to be able to reach everyone. We need everyone to respond. If you haven't responded online, if you haven't responded by phone, if you have not talked to a census enumerator, we all need you to respond. Be a good neighbor. Join Mayor Brown, I, and others, and be Buffalo Herd. Get counted. Go to 2020census.gov. It will make a huge difference in our congressional representation just as much as it'll make a difference with regards to federal funds we receive for a whole panoply of programs, senior programs, school district funding, issues associated with our roads. You name it, federal government funding is based on our population. Please respond. With that, I'll entertain questions. Yes?
Sunday Saturday is the Buffalo Bills home opener. There is no tailgating, there are no fans. However, we've heard rumblings that there's possibly going to be a tailgate protest in the lots. Wondering if you guys have heard anything about this and what you're doing in terms of tailgating enforcement.
Well, if the question was in regards to Sunday's football game, there's no fans that are allowed, there'll be no tailgating. First off, no one's going to be able to get in a county lot. Those will all be closed, so you're not going to be able to pull in. Private lots, private lawn owners, if they decide to do it, and some have agreed not to. And I know Hammer's lot, the gentleman who runs that, has said he will not be allowing tailgating in his lot. You run the risk of not only having a health inspector come out and shut down tailgating, but you run the risk of getting a big fine. So maybe you let 100 cars in and charge them $10. Great, you made $1,000, you may pay more in a fine. So to tailgate owners or lots that are thinking, hey, we're going to charge some money and have people party here, you're running the risk of not only being shut down by the health department and the sheriff's office, but getting a big fine. Would not recommend it. Watch the game at home. You can have a private party at your house. Hang out with some friends, family, cook some barbecue, watch the game. We want to see Josh Allen lead the team to victory. Truthfully, I don't know why anybody would want to drive or do a protest when the football game's on. I'd rather watch the football game. It's going to be on TV. Watch it. But we're going to have health inspectors out there as well as others enforcing the law.
Do you know if the county, as a follow-up to that, do you know if the county is going to be doing any proactive things such as, road closures to try to prevent people from even considering gaming out there?
There will be actions that will be entertained in consultation with the Buffalo Bills, but we're not going to announce them previously.
You were just talking early on about students, for example. Do you have any real ability to put the hammer on them? Can you send county people into house party? I mean, they can't be that hard to find.
First off, the question was, what can we do with regard to students and house parties? What can the county do? The Erie County Sheriff's Office went out with the Buffalo Police Department and Erie County Health Inspectors this past weekend and did not find the mass parties they saw before. They did find parties, but they were below the limit that's allowable, so they weren't shut down. If I was a student, I'd be very concerned. I think you could be suspended from school. We're concerned a lot of students aren't taking this seriously. They've gotten calls from contact tracers and have not wanted to respond, so we've had to go back to the school and say, this student won't talk with us. The school can suspend the student. School could throw the student out of school. So for the students, you run the risk of being suspended or potentially being thrown out of school. This is a public health crisis. We have an obligation to protect each other. And I would hope that students understand that maybe they're not going to get sick, or if they get sick, it's minor, but they could pass it on to someone else who gets sick and gets very sick or dies. And that's a big concern. So we will continue to work with law enforcement and our law enforcement partners to shut down large gatherings that are above and beyond the requirements under New York State law under the governor's executive order. Ron, you had a question?
Yeah, has there been an effort to reach out to, say, the fraternities and to really canvass the neighborhoods more so, working with the universities, if you are concerned about this, to really press this message home, don't party?
The question was, has there been a reach out to fraternities, sororities, and working with the universities to get the information out to the students? And the answer is yes. We're relying primarily on the colleges and universities to do that. They have the direct communication. They control the emails to the students. They know their phone numbers. All students. We get the information when they test positive, and then they're in our contact tracing system. But we are working with the universities and the colleges on getting this message out. I mean, I'd be shocked that any student wouldn't think about this as being serious. They've lived through the last 6 months, 7 months. How long has it been now? Since we started, it was basically March 15th. So we're almost on 6 months now. Some of those students had just graduated from high school and lost their graduation ceremonies and the like, so they know how serious this is. We've all been college-age students in the past. We know that while there are some brilliant college students in our region, they don't always make the best decisions. And I would just hope that they understand that it's not just themselves they're putting at risk, they're putting other people at risk. If you go to a house party and you contract COVID-19, and then let's say you go home for the weekend, and you're asymptomatic, you could pass it on to your parents. And your parents are going to be a higher risk than the student. So I would hope that the students take it seriously. But yes, the answer is we are working with the schools and the universities, but we are leaving the direct contact and the messaging primarily to the colleges and universities because they have the direct contact with those students.
Have you thought about?
Sandy first.
If you look at the regions, Western New York's positivity rate as an average over the last 7 days, just looking at the state data, it's been slightly elevated over the past couple of weeks, but pretty stable. I'm wondering about how Erie County specific numbers compare. I think you had said the positivity rate was over 2%, but I'm not sure. And I didn't know also if you attribute the college-age kids as the reason for the higher percentage.
Well, the question was in regards to how do we look at Erie County and part of Western New York and what are we attributing to the number, the cases, and is it college age? Well, I can certainly say it's definitely college age cases in the last week. That there's no denial of it. And when you look at the location of where those tests were, I mean, last week the total tests were 2.0 positive. But, you just go back, between the ages of 18 and 22, of the 496 cases last week, 18 to 22-year-olds made 42% of those cases at 207 cases. And then you look at where they live, and you see that the highest zip code last week was 14214 with 78 cases, which is the University Heights neighborhood that surrounds the University of Buffalo. It doesn't take a genius when our contact tracers talk those individuals and, okay, I'm a student at UB, or maybe I'm a student somewhere else. They just happen to live in that neighborhood because there's a lot of students that live in that neighborhood. So we are really concerned about the continued growth with regards to the college age. I'm happy to see that in general the numbers are staying lower for most of the population. But yeah, this is very concerning because this is an age that not only going to school, but they're going to restaurants, they're going shopping, they're going to bars, they're going to grocery stores. And they may not always take it seriously. We're going to do what we can to ensure that we protect the general public. And that includes reminding all that you have a responsibility, not just the 60-year-olds and the 70-year-olds and the 40-year-olds, but the younger ones too. And the other thing that I mentioned, and go back, we've seen not huge growth, but we've seen a little growth in cases between the ages of 5 and 17, which is generally school-age children. And we know that while some districts are 100% virtual right now, not all of them are. And they may have an older brother or sister in that 18 to 22 category that tests positive, is asymptomatic, and they give it to their younger sibling who then goes to school. So we are very worried about the younger age category. Do you have a follow-up?
I was just curious, so what is the current positivity rate for you? I'm sorry, I can't see this line from where I'm sitting.
For the county?
County. Do you have-
For last week was 2.0.
Or just for this past, days?
It's varied. I don't have it. We released it yesterday, actually. I didn't include it here because we usually do weekly figures here. But it was released last night. I think it's varied. It's varied from 1.5% to 2.4% on a daily basis. As you say, the daily basis is a little bit unfair because you could have a huge number on one day but then a low number the next. So that's why we think looking at it on a weekly basis is a better example of the trend lines. And as what we see here is it was 2.0 last week, it was 1.5 the week before, it was 1.4 the week before, it was 1.1 the week before. So it's basically doubled. It's not huge, but you don't like to see doubling in a month, is what unfortunately we've seen. Yes?
Can you clarify the number of cases that you said 400 and some, just from last week? 496?
496 cases were reported last week.
Okay.
Is there any chance you could simply buy some of those very poor response instant kits and just march up and down the streets in University Heights and stop people and test them?
Well, first off, the question was, can we buy some of the poor response instant kits? Well, I don't want to buy anything that does not have a exceptionally high probability of accuracy associated with it. We did receive 6 rapid ID Abbott Lab testing machines and 4,000 test kits from New York State. One of the reasons why Dr. Burstein is not here is she's in consultation with New York State as part of their discussion, their conference call meeting, to how these are run with our staff. We are not going to just use those for the general public. We're going to save them for specific outbreaks, including those that we believe may be attributable to colleges, but also workplace environments, or what we think is going to happen in the next couple weeks with schools being returned is we're going to have a child or two that test positive, and then we know every parent is going to want their child tested positive if they were in class together. So we're using it for what would be considered rapid analysis for what would be more outbreak related. And then the rest of the tests will be done by our general testing sites as well as the other testing sites. But we're not going to walk down the street and say, hey, you want to get tested? But we are going to use it where we think it's an appropriate use with regards to a potential outbreak at a particular location, including and especially schools and locations of employment.
On that
Ron?
point, Mark, I heard you call out UB, I heard you call out a location, and yet, again, you're not going to like this, about a month ago, 2 months ago, Eden, you wouldn't give a location. Now you're giving a location, a concern, I understand the concern. Can you explain why you can call out UB and the locations there, and you couldn't do that with Eden?
It's a different situation, Ron.
And the community there.
It's a totally different situation. There are 29,000 students at the University of Buffalo, and I think they have a little over 100 total. Would you ask me to answer the question?
Yeah.
Okay. University of Buffalo has 29,000 students. We've identified a location by zip code. We have not identified the exact location. What you've been asking for all along is the exact location, which would then identify individuals. I can't do that. I can't do that by law.
You're identifying individuals now, though, aren't you?
I'm not identifying individuals. No. See, the problem is what you're asking for is information that could readily identify an individual's, the person. And by law, I can't do that.
But what's a student as opposed to an occupation?
It's totally different. There are more people on the University of Buffalo campus than pretty much the entire southern part of Erie County. Nevertheless, the town of Eden.
I'm just saying.
It's totally different, Ron. I understand this is an issue, and you've asked legitimate questions. I'm not going to deny the questions are legitimate, but the answer is different. You're asking me to, in a different situation, to identify where these people live and who they are. That's what you're asking for. And I'm never, ever, ever going to announce who these people are or where they lived. Because if any of you individuals had tested positive for coronavirus, you sure you want me to identify your name or where you lived? No. That's the information you're asking for. It's as simple as that. Michael.
Yesterday, the governor announced that he's launching a COVID report card. What role is Erie County going to have when it comes to giving information to the state about schools in Erie County?
The question was, what role is Erie County going to have about giving information to the state for schools for Erie County? And as of right now, the answer is zero. The schools have to provide the information to New York State. If they did not, I assume we'll get a call from New York State saying you have to provide that. So the COVID report card that was announced by Governor Cuomo will be showing a dashboard on a daily basis for every school and every school district. But we are not responsible for providing that information. It is the school district that is.
We spoke to some school leaders who expressed their concerns, much like what you had, about the Eden case, for example, about privacy. They might not want to give the state the information out of concerns that they would identify the kids.
Well, I certainly agree with them, the district superintendents and principals that do not want to provide information that will identify kids. I think that's certainly not going to happen. The question is, are they identifying the class where the student is? I don't believe that's what the governor proposed. I thought it was just identifying a student so that people knew. Now, the problem is if you find out and you got a school with 700 students and they've been attending in person, and you say one student tested positive and went to class, every parent is going to want their student tested. And that's something we're discussing right now with New York State, but I do not have an answer for as how it's going to be resolved.
Going back to last week again, how many total tests were taken for the week ending in September 5th? I'm trying to understand the percentages. You said 496
Tested positive.
Right. So what were the percentages?
I don't have. We can get you that information. I don't have it I don't have it on the spreadsheet, but if you think about it, if there were 496 tested positive and that was 2% of all tested, you could do the math. But we'll give you the exact number.
Are you dealing with the private schools, private high schools and so forth, and private elementary schools, the same way you're dealing with the public schools?
The question was, are we dealing with private schools the same way we're dealing with the public schools? The answer should be yes, but I've not had those conversations, so I can't answer the question as to that. I do know that Dr. Burstein has been on a lot of calls with a lot of school leaders, as well as New York State Education and New York State Department of Health, been on a lot of calls with a lot of school leaders. I would assume the same is true for the private schools just as much as the public schools. It's easier some ways for us to do the public schools. We could do a giant Zoom call with BOCES 1, BOCES 2, and the public school superintendents, which we have done and I've been part of. The private schools are a little different. They like to do their own thing sometimes, but we have had conversations with them. And they're still, as much as they may be a private institution, they are still subject to the rules of New York State, including New York State Education Department and the New York State Department of Health.
I was just thinking because basically they're in class every day, as opposed to...
Some of the private schools are in class every day. I don't know if every single one is. Where I live, I've seen them going to school at Canisius High School and the long lines associated with the students entering and the long lines of cars on Delaware Avenue. I would not recommend driving down Delaware between 8 o'clock in the morning and 9 o'clock. It's pretty backed up. Yeah, we've had discussions with them. Yes.
I know this is a silly question, but it is one that's flowing into our newsroom regarding.
We got some loud phones here.
Okay, silly question flowing into the newsroom regarding Halloween in Erie County. A lot of parents wondering what could possibly be Halloween this year, if there is a Halloween at all, and if it's trick-or-treating has come up in
The
any.
question was Halloween. The answer I have is we have not had any discussions about it. Let us get through September and see where we are in October.
Los
Hol-
Angeles just canceled this.
It's a little too early for us to talk about it now. And Halloween is still more than a month and a half away. Let's hopefully by then the Bills have a nice record and the Buffalo Blue Jays are kicking butt in the playoffs, because it's looking like they're going to make the playoffs. It should be pretty cool. Any other questions? If not, I want to thank Kendra once again for offering the American Sign Language. Did you know, you'll be hearing about this more soon as we approach Deaf Access Awareness Week, that the third most used language in the United States is American Sign Language. So Kendra, thank you for all that you do. I want to thank everyone for the work that everyone is doing out there to protect our community. Be smart, be safe, be well, and wear your mask when you cannot otherwise safely socially distant. Thank you, everyone.